Good evening and thank you for joining us. I'm Avery McCrae and here are today's top stories. The Thunder Bay Regional Hospital has seen a slight drop in the number of active cases within its confines, and the hospital CEO says they had expected to reopen their dedicated COVID-19 unit when cases began to rise locally. Meanwhile, the sprinkler mishap, which led to a number of units being evacuated, was also addressed today. Corey Nordstrom has more.
One fewer COVID-positive patient is now being reported in Thunder Bay's regional hospital, though the 14 active cases still include 2 in the ICU. The 12-bed dedicated COVID-19 unit is once again up and running in the 3B unit, and an outbreak has been declared in neighboring 3A. CEO Rhonda Crocker-Ellicott couldn't disclose the exact number of patients involved in the outbreak.
The number is still incredibly small. That said, given what we are seeing with Omicron, it's very challenging at times to determine where a patient or a staff could have come across Omicron, given the transmissibility of it. It is contained. We have closed the unit to additional admissions, and we have our isolation precautions in place.
Crocker-Ellicott says there doesn't appear to be transmission with the neighboring COVID unit. The CEO also says they are dealing with staffing issues because of COVID-19. Though not directly related to the outbreak, there were 66 workers off duty isolating as of Wednesday. To address similar issues, the province of Quebec is now allowing some COVID-positive healthcare staff to return to work, but that isn't being looked at locally just yet.
We have not considered returning COVID-positive staff to work. I won't say it wouldn't be something down the road, depending on what the nature of the situation would be, but we have our infection prevention and control experts that guide us through this process, and certainly anything like that would be taken incredibly seriously.
Also at the hospital, an investigation into the cause of flooding in the 2C unit is underway. A sprinkler went off, causing that portion of the building to be evacuated, as well as the unit directly below. The 1C unit saw some seepage into ceiling tiles, which has been remedied, and the rest of the affected areas should be back to normal soon.
That unit, within 24 hours, was able to return all of their patients back to the unit, so that's back intact. There's some small damage that we're continuing to repair, and with respect to 2C, we expect that we will be able to move our patients back to the unit probably by tomorrow or Saturday.
Corey Nordstrom, TBT News.
A major COVID outbreak has been declared at the Thunder Bay District Jail. The health unit says it's a facility-wide outbreak with 24 individuals identified with the virus. The number includes staff and inmates, but it's unclear how many of each side have been affected. The health unit says it's now working with the Ministry of the Solicitor General to contain the spread. Meanwhile, another outbreak has been declared at Hogarth Riverview Manor. Yesterday, the health unit confirmed that 3 people within the Marigold unit on the 5th floor had contracted the virus, and today, 4 cases were confirmed on the Spruce Grove unit. There's no word on how many of those 7 cases involve staff or residents. In local COVID numbers, the health unit is reporting 62 new cases today, 53 coming from the Thunder Bay area. But that's likely an underestimate of the true numbers due to COVID testing changes. The Northwestern Health Unit is reporting 37 new cases and 1 new death, bringing the total to 10 in the NWHU's catchment area since the pandemic's beginning. Booster shots are coming for Ontario teachers as part of an effort to get kids back in class as soon as possible. Beginning tomorrow, a mass vaccination clinic in Mississauga will support priority bookings for education staff, including teachers, custodial, and administrative staff, as well as school bus drivers and child care workers. Public health units will work with those outside the Toronto area to provide access to 3rd doses. The province is also strengthening protections for child care centres by introducing additional safety measures. Meanwhile, Chief Medical Officer of Health, Dr. Kieran Moore, says the province will prioritize any incoming rapid tests for long-term care homes, hospitals, and schools.
We are actively working to get as many RATs. You may have heard from the federal government that they've procured additional tests for us, and we're waiting the delivery of those. Our framework, though, everyone in Ontario should realize is first use those RATs to keep our vulnerable settings safe, so our long-term care settings, retirement homes, hospital sectors, and other congregate settings. And once we can maintain that safe supply to ensure that patients are protected in those settings, we will move down our framework and provide them to be more accessible and available.
The update comes a day after the federal government said it would distribute 140 million rapid tests across the country this month. 2,279 people in Ontario are now hospitalized with COVID-19, including 319 in the ICU, and sadly, 20 new deaths have been recorded today. The province is also reporting at least 13,000 new cases, but that's an underestimate given more restrictive testing eligibility and a testing backlog. Those who work in healthcare are sounding the alarm over the strain on hospitals. They say the system is on the verge of collapse and are calling on the government to do more. Colin DeMillo reports.
The Omicron-driven hospitalizations continue to push higher. Today, an additional 145 people were hospitalized, leaving nearly 2,300 patients with COVID-19 in hospital. And those who advocate for frontline healthcare workers say they are suffering as well.
People are breaking down in their cars. They're breaking down at work. They are literally collapsing. This is like these people are coming out of war. They are without a doubt experiencing post-traumatic stress syndrome.
Unions representing healthcare workers say the strain is immense because of a number of factors. Employees are either sick with COVID-19, have to isolate due to exposures, or have been leaving the sector in droves due to exhaustion.
When the Premier suggests that absenteeism among healthcare workers is a major problem, he ignores the fact that these healthcare workers have worked for 24 months with no vacations, on extended shifts, on consecutive weekends, and they are exhausted physically and emotionally. They are vulnerable to falling ill.
Compounding the problem, unions say, is Bill 124, which caps public sector salary increases at 1%. That's below the rate of inflation. Today, members of the opposition held a rare joint news conference asking the Premier to recall the legislature and repeal the legislation.
Doug Ford's low-wage policy is a slap in the face to all of those healthcare workers that we laud with words, and words are not enough. We need action.
But the Ford government points out workers have been receiving pandemic pay. The province is incentivizing people to enter nursing programs and said today in a statement it is inaccurate to suggest that Bill 124 caps wages at 1% annually. Under this legislation, the government says, Ontario public sector employees will still be able to receive salary increases for seniority, performance, or increased qualifications as they do currently.
Bill 124 is more than about wages. It is a hard cap on every single benefit that would support workers right now. Benefits like mental health counseling.
We have no psychological counseling in our collective agreements, and we can't bargain any for 3 years. That's the effect of Bill 124.
The government has not committed to recalling the legislature.
Healthcare shortages across the province, a new $10.6 million investment by the Ford government will see hundreds of new healthcare workers trained in partnership with Confederation College. The new investment will focus on training 500 workers for in-demand jobs at hospitals, long-term care homes, and home care providers in Northern Ontario. Confederation College will lead this project that will cover training, fees, and textbook for participants, prioritizing those who are unemployed, underemployed, or at risk of losing their jobs. Each trainee will receive a job placement in the community, with ongoing support continuing after graduation. Even though this initiative will focus on personal support workers, both Greg Rickford and Kathleen Lynch say this will make a huge impact throughout the province of Ontario.
Personal support workers are used throughout the system. So not just in long-term care. Recently, our Thunder Bay Regional Health Sciences Centre, and I know our other regional hospitals, have been hiring PSWs because of the shortage of skilled healthcare workers. So they see a role for them right throughout the healthcare system.
There is no question that the single largest deficit that we have in the human resource suite of positions are personal service workers and home care workers, particularly for our smaller, more remote and isolated Indigenous communities and smaller municipalities. And to that extent, this is an exciting opportunity.
Anyone wanting to apply to the program can contact Confederation College. Classes started in November of 2021 and will run until September of 2023. One day after people were left confused and frozen outside a local rapid test pop-up site that never opened, things went a lot smoother this morning. The distribution site located at the former Edgewater School opened its doors just before 7 a.m. with staff handing out free rapid tests for over 2 hours. Jessica Clement has the story.
For the third day in a row, hundreds of people came by the pop-up site hoping to receive take-home rapid testing kits. And unlike on Wednesday, when the location failed to open due to the weather, the free kits were being handed out at a steady pace before the sun came up. And the residents we spoke to were all happy to get their hands on one.
To be able to check. And I also have people in my life who are vulnerable, and I want to make sure that, we are safe when we're around them, immediate family members. So yeah, I think it's just a valuable tool, a resource, another resource, just like our masks.
I do have 3 vaccines, but I also feel that this will give me a little more security knowing that I've done everything that I can possibly to keep this under control.
With the low number of tests available around the province, residents are encouraging others in the community to make the most out of the pop-up site and to get their own tests.
I don't see if they're available, why not take advantage of it? It's just we want our community, our whole city to be safe and get this virus out of our lives.
I believe that everybody should have access to these and do their own home tests so they can go out to the community safely.
It would be prudent for everyone to have some. There's some people that have many of them, and there's people that don't have any. So I took the time this morning to come and grab one.
The free kits continued being handed out until about 9 a.m. when the last of the day's supply ran out. Staff at the site wouldn't say how many they had, but it's believed there are at least 1,000 kits up for grabs. The pop-up site may be open again on Friday morning due to Wednesday's cancellation. However, the provincial website has not yet confirmed that. Jessica Clement, TBT News.
Well, after the massive fire at the Finnish Labour Temple last month, it looked like everything inside was lost. But an iconic treasure from the Hoito restaurant has been salvaged and is now on display for the public to view once again. Mitchell Ringos has more.
Now sitting at the Finnish bookstore, many people in Thunder Bay will remember the old-fashioned scale that stood for decades at the front entrance of the Hoito restaurant, used by customers to weigh themselves before and after their meal, which became a Thunder Bay dining tradition. Following a devastating December 22nd fire that destroyed the Finnish Labour Temple, building owner Brad McKinnon found the scale submerged in about 4 feet of water. After dragging it out, he was surprised to see it was still in relatively great condition. McKinnon said he wanted to save something from the building that everyone could identify with, and as a reminder to keep high hopes for its future.
And I think it's important that it stands here at the Finnish bookstore as a symbol of resilience. The fact that we're not giving up, we're going to push forward, and we want to give everybody an opportunity to come in and get a picture, look at it, and just a reminder to the community, don't lose hope.
The scale will stay at the Finnish bookstore until the original building is restored, so you can't weigh yourself just yet. But Finlandia Cooperative of Thunder Bay interim president Paula Happonen says plans to reopen the Hoito restaurant are still in the works, with potential pop-up Hoito diners continuing to sell their world-famous pancake mix and a new coffee blend. Happonen also spoke about what it means to the Hoito for the scale to once again be back on Bay and Algoma.
It's a small little beam of sunshine in all this, in all this bad news to have that scale, because the scale is an icon. Everybody who's been through the doors of the Hoito has been on that scale. So it's kind of a symbol of resilience, I'd say.
Co-owner of the Finnish bookstore, Richard Koskanimi, said there was no hesitation when asked to put the scale in the shop, and now has plans for a fundraiser in association with Charlie Wilkins, author of Breakfast at the Hoito, to compile the community photos or visual memories into a book, with the funds going towards the restoration of the Finnish Labour Temple.
Also, what we want to do, working with Brad, of course, is we're going to be selling bricks from the building, so people could come and buy a brick and keep a piece of history.
At the moment, you can't jump on the famous scale like we used to, but they are bringing someone in to look at potentially restoring it, so in the near future, the scale's tradition could soon be back. Mitchell Ringos, TBT News.
Well, as temperatures continue to drop, another local organization has opened a warming center for the vulnerable population, this time on the city's north side. Elevate NWO, in collaboration with the Ontario Aboriginal Aid Strategy, has had its warming space available since early November, and there's been a big increase in usage since that time. Vasilios Bellows has the details.
The new warming center on Cumberland Street is the first of its kind on the north side of Thunder Bay. It offers a safe place for individuals to get out of the cold and enjoy a hot meal and coffee. Director of Harm Reduction Phoenix Schweitz with Elevate NWO says one of the successes of the warming center comes from its peer-to-peer format.
Those that we have brought into the warming center to help us organize it and run it are those who were involved in the underhoused community in Thunder Bay this past summer and fall.
Elevate NWO provides more than just a safe place to warm up, with a variety of entertainment elements in the building for those using it. There's bookshelves for anyone who likes to read, along with a collection of board games. There's plenty of space in the common area for people to safely distance around the television during their stay, and computers with internet so warming center users can access certain services they might otherwise not be able to, a necessity for many aspects of everyone's lives these days. Community prevention worker with the Ontario Aboriginal Age Strategy, Melissa DeChamps, says they have also provided cell phones for those in need.
So people can make appointments for medical appointments or whatever. And so we provided quite a few cell phones to folks so that they are able to call their doctor so they don't feel so socially isolated during the pandemic.
Meanwhile, there's another warming center on the south side of town at nonprofits People Advocating for Change Through Empowerment, or PACE building. Kyle Arnold is a client support at PACE and says the harsher weathers over the past few months have drastically changed the center's usage.
We're getting a lot more clients in now as the weather's changing, so is the amount of people we're serving. We're getting a lot of the vulnerable. A lot of them don't have jackets, don't have gloves, toques, things like that.
While both Elevate NWO and PACE warming centers have seen significant increases in usage these past few months, they are expecting their peak soon as Thunder Bay nears the harshest temperatures of the winter season. Vasilios Bellows, TBT News.
Well, Mitchell, thank goodness for those warming centers around the city, as today was another cold